It's very hard to cover non-invasive body sculpting in just 20 minutes. So what I want to present to you is just some of the two technologies which I think are winners in any aesthetic practice. As you start an aesthetic practice, as you sustain an aesthetic practice, you need to have certain techniques and certain machines that are fairly easy to operate, give great results. One machine which I'll perhaps the technology maybe which is FDA approved in the US, but also the emphasis again is inside outside, as I was mentioning yesterday, and I've always tried to link the two together because this is anti-aging and regenerative medicine. Some of the technology which I'm going to present to you today, it's also amazing to be used as when you reduce fat reduction. As you reduce fat, liquefy fat, eliminate fat from the body, you're going to decrease inflammation. Your inflammatory markers can have a chance of decreasing. So this becomes very important when you think about detox as well. So just keep that in mind as I go through some of the technology that we're presenting. So non-invasive liposuction, for body sculpting, we always talk about minimally invasive liposuction. It's an alternative to surgical liposuction in which fat cells are removed through various non-invasive breakdown and liquefying techniques. So adjunct to traditional liposuction for stubborn areas of fat that do not respond to diet and exercise are non-invasive. There's no downtime. It's usually pretty consistent results, painless, ideal for physicians looking to build or expand their liposuction practice. And liposuction is the world's #1 cosmetic procedure currently. So if you can do it minimally invasively, that's definitely preferred. And there's several ways as you approach that. One is, do you start to liquefy? Fat is cold and hard. And what you need to realize is that everybody's fat is a different consistency. Some are going to have that stubborn, cold, hard fat. Some may have a little softer fat. So the quality of fat actually makes a difference when you are doing these procedures. And that's something which when I started, I didn't think about it. So when you have your liposuction machine and you've got those lasers, maybe on some people you need to do a pre-treatment to start to liquefy the fat if you're thinking that that patient is going to have that cold, hard fat. Maybe you don't need to do that. And maybe all you need to do is a little subdermal release before you start to do the laser. And so those are some of those ideas I just want you to introduce in 20 minutes. That's all I can do, but start thinking about the quality of fat that you're going to be dealing with in that patient. I think that is probably the most important take-home message in this lecture. So non-invasive techniques consist of laser. So there's a lot of lasers that actually emulsify the adipose tissue, causing the collapse of the adipose tissue and secretion of triglycerides and fatty acids. And I can't name the machines, but there is one machine in particular in the US that does this, and it's FDA approved. The Mayo gave its blessing, the studies were done. Mayo looked at this, the Mayo Clinic. It's a session of 6 treatments, FDA approved protocol, which I use very tremendously, and it's with great success, no downtime, painless. And what I do is, again, start taking the person's body composition before and after the treatments. So now you're working. Now, if it's going to emulsify adipose tissue, what does that mean? It means it's liquefying it, correct, with a laser. So you're going to have the appropriate laser length, to a laser intensity to be able to hit the fat, correct? But what's going to happen with that? When that fat liquefies, what happens? You have to get it throughout the lymphatics. It's not just going to evaporate. Okay? A lot of times it's, okay, I'm not going to think further. I just liquefied the fat. How is it going to get eliminated? So if the person has more detox issues, their lymphatics are not working well, maybe they're in their liver issues, they're not going to be able to clear that fat. And so the results are not going to be as optimum. So when you have a patient that is not responding to treatment, start thinking along those lines. Maybe they have more detox issues than you know of. Maybe that fat is really hard fat, and maybe they're going to need more than the 6-session treatments. So those are the kind of things that I really want you to try to focus on when you just think about, oh, here's a fat reduction machine, let's just follow the protocol, 6 sessions, it should work. No. Think about what is physiologically, biochemically happening to that patient, even an aesthetic patient. Inside out, please. and then you have secretion of triglycerides. What if you just release a lot of triglycerides? Would you not want to perhaps clear them? So how about niacin, using something like niacin? If there's no contraindications, that might be something to consider post-treatment to utilize in that patient. So I think just thinking along those lines, you'll start to realize then this procedure then for fat reduction becomes very important. And maybe you might want to emulsify the adipose tissue before you do your liposuction, minimally invasive liposuction. If you're really suspecting that cold hard fat, maybe that's something that you'd want to do pre-treatment, a series of this, and then you want to introduce that, do their minimally invasive liposuction, and then you do, of course, with that you released a lot of fat cells, a lot of toxins, so post-liposuction, you might want to then use a treatment where you're going to enhance the lymphatic drainage at that point, correct? So that's just one of the non-invasive techniques. Radiofrequency magnetic. Now, this is also very interesting. Uses radiofrequencies and magnetic pulses to emulsify fat cells. So the old first one was a thermography, the unipolar, correct? Where you had a heat entry point, but it was kind of left up to the unipolar. A radiofrequency was like, okay, where is the heat going to go out to? Sometimes you would have burns because you never could predict where that arc is going to go out. Okay, then came bipolar, so that was better. Then now there's multipolar, and that's a technology which I want to present. I think that's cutting edge. Multipolar technology, we'll get into it. So there's cryolipolysis, the cold laser. Controlled cooling allows for cell death of subcutaneous fat tissue without damage to overlying skin. Reduced fat content is naturally absorbed and flushed from the body. So maybe you're cooling for the cell death and you're releasing the fat, but if it's cold hard fat that you're releasing, you might want to just follow it with the laser post-treatment. Or even the cryolipolysis. Then you have the ultrasound. Ultrasound waves transmitted through probes stimulating lipolysis of fat cells, causing triglycerides to be released from cells. So maybe now you've got triglycerides being released. And you've got an older person. That's not a good thing to have that much triglycerides. You don't know how they're going to clear it, what their physiology is, what their metabolic clearance is. So maybe you might want to enhance that through the use of certain nutrients that decrease triglycerides. Fish oils, omega-3 fish oils decrease triglycerides, correct? So this is the multipolar radiofrequencies. There's two synergistic components to effectively treat various skin conditions. One is a radiofrequency thermal mechanism, and then there's also pulse magnetic fields, which is a non-thermal mechanism. I want to talk a little bit about, which I didn't say in the first beginning, was about pulse magnetic field. It's relatively new. We use it for treatment of depression. We've used it for pain. But in aesthetics, I want to give you the biochemistry of how pulse magnetic fields can work. It stimulates angiogenesis. That's what really it does. It's pretty exciting. So magnetic therapy, past and present. We've progressed to having magnets sort of on the earth. We've gone to 18th century, we had, of course, the real magnets. Then 19th century, we have a lot of the electromagnetics, and 20th century is now the pulsed electromagnetic fields. It's used for wound healing, bone healing, pain relief, post-operative pain and edema, Parkinson's, migraines, depression, and MRIs use electromagnetic fields. So at a cellular level, what happens? The cells in the body have a basic electrical potential proportional to the rate of ion exchange across the cell membrane. The ion exchange is influenced by the pulsating magnetic field, and the flux of calcium ions enters the cell and activates cellular and molecular responses. And by doing that, what essentially you're doing is you're creating an electrical current, and there are little eddy currents that you create. The electrical potential across the membrane gets changed, and then it stimulates a flux of ions. So at the molecular level, you get improved, because of all of this ionic flux, you can improve vascularity. Therefore, you get angiogenesis, which is a process by where you have certain growth factor FG, F2 released from the macrophages and new endothelial cells induced by PMF, whereby new blood vessels sprout from pre-existing vessels. There's also fibroblast proliferation. FGFs released from macrophages and endothelial cells induced by PMF stimulate proliferation of fibroblasts, and synthesis of collagen fibers by non-thermal stimulation of dermal fibroblasts. Angiogenesis, this is after with pulse, there's before and after pictures you can see. And there are certain technical specifications that are required, or well, at least in today's, things keep changing, but at least in the current technology. You want to use low frequency, about 15 hertz. Pulsed magnetic field flux, about a 15 Gauss, about a 1.5 Tesla. Teslas are generally, they're alternating waves, and which permit you to actually, that's where the pain, like the regular, when you treat pain, you will usually have low voltage and high amp, and that's the tens unit. But if you use this Tesla technology with this alternating current, you alternate waves, you actually can get high voltage without burning, so you can get high voltage and low amp. That's a huge difference. So a lot of people may think that the tens unit is the same thing. It's not. Just be aware of that. PEM mechanism before treatment, and just basically, again, it hits at the through the pulsed electromagnetic fields, as I've already explained. The fibroblast, you can get production of collagen. It affects at the hypodermis level. Now, this is a sort of repeat of just what I said. The electrical current induces magnetic fields. The periodic movements of the ions in the dermis creates the eddy currents. You have a membrane potential is altered. FGF2 is released. And the fibroblasts are stimulated to synthesize collagen fibers. FG2 stimulates proliferation of fibroblasts and neovascularity. Now, this combined, now the exciting part is you don't just do PEMF separately. There is a machines that you can get that can actually combine the two. So now you've got a PEMF, but with that, if you had multipolar radiofrequency, and what is multipolar radiofrequency? You can create multiple arcs, so there's beginning and end points, so there's no burn. It's relatively painless, because if you have an 8-head multipolar, you can create these arcs. Let me explain. So you get also homogeneous heating. With bipolar, you don't get the homogeneous heating. So there's no real spikes. And a lot of times when you do the radiopolar, the radiofrequency bipolar, you kind of, the patient gets a pain or feels pain, you kind of interrupt the procedure. You don't really reach that temperature, and then it goes down, and then you have to go. With this, you allow it to give you a much more homogeneous temperature, is painless, and you can maintain that temperature. That is a key thing for the success of the treatment, is to be able to maintain that temperature without the pain. So there's various penetration depths. You get a sort of a three-dimensional, because of the arcs, the way the arcs are created, you almost get a three-dimensional penetration. You can do large treatment areas. So there's a comparison of the skin temperature and treatment time of multipolar radiofrequency versus the standard radiofrequency. So you have the pain is pretty much the limiting factor, pain and burns. The end point, if you can accomplish without hitting the pain level or the burn level, that's your success of your treatment. So with so watch what happens with the green, of course, is a multipolar radiofrequency. You don't get the spikes. You get it also as a synergistic effect on the skin, because you can, with that, of course, as we know, radiofrequency can stimulate the synthesis of collagen, fibroblast proliferation, neovascularity. This is through the combined PEMF and the, so here's the PEMF, which is doing the synthesis of collagen, fibroblast proliferation, the neovascularity, and then you get the contraction of the collagen with the radiofrequency. So the two combine, and of course, then you get the synthesis of collagen and elastic fibers, and you get, and of course, with this machine also, it will target the fat cells as well. So you get a little, you get some lipolysis as well. And the result is you get skin tightening, improved elasticity, you get circumferential reduction, cellulite reduction, anti-aging effect. Here are some before and after treatments. And this is usually a session of about 6 treatments, depending on if you're treating the face. Sometimes you go 4 treatments, you can see a result. Again, the protocols have to depend on what the patient's inside is, correct? This is what I want you, you are going to get the gauge. That's why when you educate your patients, don't say, oh, it's 6 treatments are going to give you results. I think that's the worst thing we can do. We're going to find more and more patients' unsatisfaction simply by saying how many treatments. It's a good idea to say this is generally the protocol, but because of your body, we don't know the consistency of your fat. We don't really know metabolically everything about you. Let's at least give this a try, see if you see a result. It may take longer. You may actually be on the benefit and actually see results in a shorter period of time. Overall, in my experience, you do see the results. The patient will see the results, they'll continue the treatments. Okay? And this is a great alternative to the Titan, which is the Cutera's Titan and a lot of the other tightening procedures, skin tightening procedures. And it's painless. Very relatively painless. If you know, just working the device, much easier to use than some of the other machines that we have. Again, this is a great before and after 3 treatments. It looks almost, this is the arms, which is another really hard spot, as you know. Our underarms is really hard sometimes to do. So non-invasive laser emulsifies fat, allows it to move into the interstitial space. The triglycerides and fatty acid evacuation allowed via the formation of a transitory pore. The procedure allows for the release of cellular, this is through laser, the laser mechanism. This is the machine that allows that. This is the FDA-approved protocol that I was mentioning. The procedure allows for the release of cellular contents of fat cells while leaving the capillaries and other cells within the interstitial space intact. This is the non-invasive, the laser, and metabolically what's happening here. You can see the pores and you can see the fat being emulsified. Subcutaneous fat, now that's another thing. We know that we've got subcu fat and visceral fat. So when you talk about fat reduction, educate your patients. You can get at the subcutaneous fat, it's very difficult to get at the visceral fat. So the subcutaneous fat is just going to be under the dermis. But you're not sometimes going to be able to reduce visceral fat. And patients need to, this is the reality, patients need to be educated on the 2 types of fat that we have. So when we talk about fat reduction, generally we talk about subcutaneous fat. Now, with minimally invasive liposuction, I have seen, because of the decreased inflammation, and if you do the right protocols before and after, you can get some reduction, again, metabolically, of the visceral fat. So subcutaneous fat is located directly over skeletal muscle and underlying the skin. Effectively liquefies subcutaneous fat due to its superficial placement, ensures proper depth penetration of the laser energy. Application of laser therapy at 635 nanometers to cultured adipocytes reveals the formation of the transitory pores within the bilipid, and there you get that the emulsification. By utilizing the formation of the transitory pore, you avoid the complex breakdown of fat cells through lipolysis, which is regulated by a multifaceted framework. Here's again some befores and afters. And I encourage you to get measure. You should have the proper way to measure. Always measure the same way. The picture should always be taken the same distance. And also do the body composition. We have a machine where, at my clinic where I do the body composition. So I'm able to tell. It's very selective. You can tell if you're reducing fat from just the upper part of the body or the lower part of the body, or just how the fat is even shifting. Because as we know, fat cells shift as well. So it's really nice. Patients like to see that. Plus, it monitors our results more accurately. There's also cool sculpting. Sculpting progressively cools the cells to cause lipolysis. So the fat cells are naturally more vulnerable to the cooling than tissues surrounding the adipose. Thus, under controlled conditions, the effective removal of fat cells through cooling reduces body fat without damage to the surrounding environment. But I will tell you, after procedure, post-procedure, I would recommend using emulsification process because, again, you are dealing with the consistency of the fat. It's easier to move the softer fat than it is the cold, hard fat. So non-invasive, the ultrasound, utilizes optimal ultrasonic vibration energy to dislodge the fat cells from the tissue matrix while preserving connective tissue and maintaining fat viability. Ultrasound process utilizes acoustic streaming process, allowing for the selective emulsification that breaks down intact fat cells, which are then aspirated. So again, the global market, this is important, I think, to realize that women want to see a result, but they don't necessarily want to have this drastic surgery any longer. They want to just feel good. They may not be looking for that super perfect body, but they just want to know that they did something, they see a result, so they can feel happier among themselves. That's really, at the end of the day, what we're looking for, correct? And so if these are the type of machines that are, I think, are home runs. At least in my practice, they've been. These are the ones I would place first without going into complications. Then you progress from that. The global market forecast, I just wanted to give you some statistics. Non-invasive aesthetic procedures, as you can see, from 2006 to 2011, it's pretty dramatic. Body shaping and skin tightening equipment revenue proportionally has gone up dramatically. You have 78 million baby boomers, and it's really growing. It's a growing field. And the technology that's offered can be non and minimally invasive, well-established safety and efficacy, advances in treatable conditions, cost-effective with rapid return on investment. And again, the skin tightening and rejuvenation market, again, as you know, it's growing. All of you are very aware of that. So aging skin isn't the only concern. You have loose skin, localized fat deposits, cellulite, and this is really why the market is expanding, because we really are going into body sculpting. But again, realize that part of body sculpting is also combining that with detox is very, very important. Okay, thank you.
Okay, thank you, Dr. Naina, for a beautiful presentation. Thank you.